Good morning to all and welcome to the third day of Makati Medical Center's webinar on mental health. I am Dr. Vasquez-Genuino, here to discuss how we can address the experience of children and adolescents during the COVID-19 pandemic. Let me start by defining what a disaster is to see for yourselves if this pandemic fits the description of a disaster. According to Schoenfeld and De Maria in 2015, they define disaster as a one-time or ongoing event of human or natural cause that affects groups of people and who experience stressors such as threat of death, bereavement, disrupted social support systems, and insecurity of basic human needs. A disaster has the potential to cause both short and long-term effects on the psychological functioning, emotional adjustment, health and development of children as well. And this is what is happening now. As Imran et al. From Pakistan mentioned in their study on mental health considerations of the youth, published last May 2020, this is a public health emergency. And if so, we have been living in this abnormal situation, this lingering disaster, for the past 7 months now. Public health emergencies, like pandemics, take a toll on physical as well as mental health, and more so with children who have limited ability to understand what is going on or why. Even if we think they won't or don't understand, you will be surprised what they pick up when overhearing our conversations and supposedly not listening to our TV news. Perhaps some of us adults have experienced a myriad of emotion, and half the time we don't understand how to react or what to do. With so many webinars, so much housework, and so many deadlines imposed by the office, it seems life has become even more hectic than we had expected, despite the fact that we're supposed to stay at home. For today, I was tasked to tackle how do we address the pandemic experience of children and adolescents. In this presentation, I hope to achieve the following objectives with you. Know how children may be affected by the pandemic, understand how children view separation and loss, and know how can we adapt or help the children to adapt to this situation. What are some of the issues that affect the youth which we need to address so as to minimize the impact on them? Loss of structure, stimulation, and socialization, unavailability of friends, teachers, counselors, adjustment to online classes, no safe space or social work services, risk for sexual and physical abuse at home, limited ability to travel or engage in leisure activities as before, separation from family members, worry, anxiety, fear of getting sick or dying, and level of parental stress. Quite often, our children react to situations pretty much in the same way that we do. Thus, the need to look at how adults are affected by this pandemic situation. Adults may be stressed about the following: not having a job or not earning as much, the boredom of being enclosed in a limited space, isolated from other social contacts, or crowding in the home. The tension and fear of this abnormal situation that has dragged on for months has made parents more short-tempered and possibly scold their children more often. Previous family conflicts that could be avoided by leaving the house have now been thrust in our face on a daily basis, thus adding more friction among those locked down in their homes. In a U.S. survey of parents, more than 50% admitted having financial troubles due to social isolation, and thus have adversely affected their parenting skills. Parents may be displacing their frustrations on their children. Those who use drugs and alcohol are more prone to prey on their children since these are the available victims at home. Kids may be safe from the virus, but not from family violence, and there have been reports of increased incidents of child abuse during this time. A very influential factor is the level of parental stress and parental emotional reaction to the pandemic. Children are wired to look to their caregivers to interpret how safe they should feel or react. If the primary adult or parent is calm, then the child will also feel calm, reassured, and safe. But if the adults around are frequently tense, upset, or hot tempered, then the child feels anxious, scared, and unsafe. The body and brain will go into a threat mode, and if this threat mode goes on for a prolonged period of time without any sign of relief, then physical and mental health problems will definitely arise. Parents' fears and worries about their own health and inability to meet their family's economic needs may be absorbed by their children, who are sensitive to the emotional cues from parents. For stressed parents, working from home while simultaneously caring for children 24/7, how can they balance these obligations while catering to their own personal needs? Is it possible to divide our time into so many parts? Perhaps we can divide our time into 1/4 we dedicate to attending fully to our children, 1/4 to doing things for the family, 1/4 could be our me time, and the last 1/4 for prayer, worship, or praise, which is like multitasking since we can address the needs of all in the family during prayer. What is important is to be flexible and forgiving of self and of others. Remember, the biggest lesson we can teach our children is that yes, we make mistakes, but we try not to repeat them. And of course, we will do our darnest to undo the consequences of our mistakes. We try to make amends and sincerely apologize for our shortcomings and errors, even if this entails saying sorry to our children. This will make the child appreciate our efforts at least, and in a way, we can model humility for them. Because schools are closed and there is no face-to-face encounter, many students are deprived of the opportunity to hang out with friends, talk to teachers, or visit their guidance counselor, and thus left with less social support. With the online classes, there is still a disruption of previous routine, loss of structure, stimulation, and socialization enjoyed compared to when kids actually went to school. Many students do miss the actual face-to-face encounter. What we are left with is this virtual reality we experience through our computers and the internet. But it is simply not the same, and it feels different. Who likes this new abnormal situation? A social psychologist of UC Irvine, Roxanne Cohen-Silver, who specializes in human responses to mass trauma, noted that the closer the individual is to a crisis, both geographically and personally, the greater the impact, and the impact on a child's sense of safety depends to what extent the family is affected. That is, if there is loss or death in the family, or if there is a drastic decline in the economic status of the family. If so, that would spell a graver impact on the child. With the social isolation and stay-at-home directive of the government that requires a lot of official documents and passes just to cross the borders of the different provinces, the previous means of coping by going out to the malls or traveling to the Tagaytay, Baguio, or Palawan are no longer feasible. This is not just because of the government restrictions, but also out of our own fears of getting sick with the coronavirus and the strong possibility of dying due to its complications, regardless of age. There are 5 factors that influence how children and teenagers may react to the pandemic: personal experiences, their developmental stage, past traumatic experiences, previous psychosocial adjustment, and quality of their social support system. With regards to personal experiences, we need to evaluate to what degree have routines been disrupted, home life disturbed, and safety of their family or household members been jeopardized. How isolated are they from other family members and friends? Have their parents gotten sick or hospitalized? Has there been a death in the family? Have they been exposed to any emergency situation? How is the physical and mental health of those living with them? And how has the family's economic status declined? All these personal experiences may adversely affect the child and teenager. Children with most direct exposure to the pandemic or whose family is struggling with disease, food shortages, or other deprivations may be most at risk for psychological disturbances. The second influencing factor is the child's age or developmental stage, as this determines how the child understands and copes with the pandemic situation. That is, what are their thoughts about the pandemic? How do they interpret what is actually happening? How does the virus make you sick? They wonder. All these may lead to exaggerated fears and unfounded worries. Some children less than 12 may still mix reality with their imagination. Therefore, there is a need for simple, neutral explanations about the virus and its risk of infecting us. The third factor are past traumatic experiences that make a child more prone to be re-traumatized by this pandemic, especially if parents are overly anxious and fearful themselves. There is a need to be more aware of the child overhearing conversations or news about the pandemic, as these may heighten their fears. We need to be careful not to project our fears onto them. Media exposure may trigger past traumatic experiences, and thus the need for parents to also take control and act as a board of censors at home. All children need to know is what is applicable to them personally. For example, why can't we go to the malls? Why do we have to wear masks and face shields when we go out or meet with other people? Why do we have to wash our hands all the time and disinfect everything? Could we say it is the latest fashion trend? Or perhaps we would like to play a game that would require such protective equipment? Teens and preteens, on the other hand, can take in more factual information and actually be interested in what is going on. They may want to understand how this pandemic started or how the virus spreads. Whatever the case, it is still prudent not to instill so much fear or hopelessness about the pandemic situation. The challenge for us adults and parents is to remain constructive and specific. What we can do to minimize the risk of infection, improve our immune system, as well as prepare them for any emergency. The fourth influential factor would be to assess the child's previous psychosocial adjustment, which is determined by his personality and coping skills. These can be innate or learned. If a child or teenager was previously doing well in school and able to establish friendships, then he would most likely be able to handle the changes brought on by this pandemic. That is, his ability to adjust to the online classes, which now entails more self-discipline and motivation to learn independently. But if the child has had previous mental health issues, being depressed or anxious, then there may be a need to be more proactive and resume with his therapy. Lastly, we need to check the adequacy of his social support system, which may be from family or extended family, classmates, friends, teachers, counselors, neighborhood, and the community. In the community, there is the Kabataang Barangay, the church, youth organizations, NGOs, and other government agencies. Schools could establish mental health programs that would allow opportunities for students to share their thoughts and feelings with a teacher or guidance counselor online. There could be curriculum changes that incorporate in the class sessions how they have been during the lockdown and inquire about their family situation so as to screen for the possibility of child abuse. The length of classes online could be shortened to avoid boring the students. The method of teaching has to be more age appropriate so that learning online becomes more interesting and fun. These trying times are stressful for young and old alike, so perhaps we could be more flexible with our rules, extend deadlines, and be more supportive rather than punitive for both the students and the teacher. As we may be experiencing the same difficulties regarding internet access, for example, or personal, psychological, or psychiatric problems. Parents have to be there for their children and provide open lines of communication. Being with parents or a familiar adult throughout this time of quarantine may be the most important aspect of helping the child to cope with the situation. Children are most resilient when they are embedded in a network of social support, even if that support comes from someone other than their parent or family member. What is important is that there is a caring and actively concerned adult attending to the child and his issues. And if the parent is quarantined away from their children or admitted to the hospital, other committed adults can pitch in as caregivers. So, what are the psychological reactions of children and teenagers to the COVID-19 pandemic? The universal reaction is regression. No matter what age, when under stress, children or teenagers may revert to an earlier stage, a previous way of feeling, thinking, and behaving, so as to cope with the emergency situation. Let us now discuss the issue of separation and loss, even if these may not be that universal an experience for children, but it could also affect them, and teenagers as well. How would a child or teenager feel when a parent tests positive and has to be quarantined at home or elsewhere, and if the parent is symptomatic with difficulty of breathing, has to be admitted to the hospital? What then is the impact of separation from parents? The infant who is just beginning to develop his attachment and trust on their parents, once they are thrust into an unfamiliar environment where he is left to a stranger while parents are away, can be a frightening experience. Toddlers tend to be more active as they are curious and eager to explore the environment for as long as they are assured of their mother's presence, but once she is gone for long periods of time, may retreat and remain passive and quiet until she returns. Since they are still unable to express themselves or their feelings verbally, we can only assume how they are by their behavior. They can become more defiant, demanding, or dependent and regress to an earlier stage, thus giving up their explorations as they now have to deal with being separated from their parent. Mother's visit to the hospital may be felt like being abandoned, never to see her again. This exaggerated reaction may be due to their unrealistic sense of time, wherein a few days can seem like eternity. Regression would be at this time at its height because it helps the child conserve energy, accept attention and care from others that will facilitate his recovery. For the preschooler who has a self-centered perspective of everything that happens, he may think that mother's illness was his fault, especially if she had just scolded him for a misdemeanor before she left for the hospital. Reassuring the child that his parent getting sick or going to the hospital is not his fault would relieve him of his guilt. And should mother be placed on home quarantine, the preschooler might think that mother is angry with him or doesn't love him anymore, because even if she is there, she doesn't come close or hug him. At this stage, the child normally tries to do things on his own, like dress up, wash his hands, and brush his teeth independently. But when wrought with guilt and rejection, will lose his motivation to try anything on his own. Mastery of skills is the developmental task that the elementary school child needs to accomplish. Thus, it might be helpful for both parent and child to research on the internet for reliable sites where the child's questions and doubts could be clearly answered. Learning new information would give him some sense of accomplishment, and knowing what are the necessary precautions would give him a sense of control over the situation. Even if at this stage the child is more logical, he may still dip into self-blame and punish himself for having caused his mother or father to get sick. Or he may think he is inadequate since he was not able to prevent them from getting sick. Adults need to clarify his misconceptions, aside of course from encouraging him to express his underlying feelings, but do so without judgment. For the teenager who is striving for independence and establishing his individuality, allowing him to participate in discussions and making decisions about the family may let him know that his opinion matters. Being separated from parents at this time may be more tolerable since the teenager actually has more freedom when parents are away. The teenager, though, may still have mixed feelings of anger and frustration, which may lead him to be more assertive, aggressive, and rebellious. But underneath that facade is someone who is actually feeling helpless or depressed, especially since his future remains uncertain with the pandemic hanging over his head. Giving him responsibilities and choices may help him regain self-esteem and semblance of control. So what happens if the mother or father dies from COVID-19? When a parent dies, how will the bereaved child or teenager view this loss? Infants up to 1.5 or 2 years old hardly have any concept of death, as they are just beginning to be aware of the external world, and only beginning to realize that things continue to exist even if the object is not in front of them. So loss of a parent at this time would probably have minimal effect or impact for as long as there is another person providing for his needs. Children from 2 to 6 years old don't really understand the seriousness of death and may think of it as temporary. That is, that the parent is just sleeping and will wake up in a few days, or has gone to another place but will come back again. Although the 7 to 9-year-old child may know that death is real, he considers it as something external and distant. Children like to imagine death as a person or creature who catches and takes people away at night. So if you can hide or escape from this creature, then you won't die. It is only when the child is around 10 years old or more that they realize death is inevitable, universal, irreversible, and final. But at the same time, even if death means the end of life here on earth, they can now understand the concept of an afterlife. Thus, the soul or spirit of the person may live on. By this age, the child understands that death is just part of the natural cycle of life. For adolescents, they have a more realistic point of view about death and probably can understand its true biological cause. And what becomes more important at this point in their life is what is the meaning and significance of his parent dying. He may begin to fathom the possibility of his own death, but meanwhile, what is more perturbing is the disruption of his teenage life, his activities, having fun with friends, or studying and pursuing a career. Let us also consider the effects of losing a loved one for the parent who is left behind. When one parent dies, the surviving parent becomes responsible for the financial, physical, and emotional needs of the family. There may be less time to fulfill all obligations as provider and parent, There may be less money to spend for vacations that the family had previously enjoyed when both parents were still around. The family may need to move to another house and the kids transfer to another school to lessen the expenses. The surviving parent may at some point date or remarry. All these disruptions may cause anger and resentment, as the child may perceive that their wants and needs are no longer deemed important. Encourage the child, and more so the teenager, to talk about their feelings. Help them understand that their feelings are expected and normal. Let them know that you, the surviving parent or caring adult, are there for him and willing to talk about death if he wants to, so as to facilitate the process of mourning and hopefully come to terms with the losses that death of a parent causes. The surviving parent who lost his or her spouse may not be emotionally available for his or her children and would require emotional and physical support from others until he or she has resolved the grief and can assume parenting responsibilities again. So, what are the normal stages of grief for both child and adolescent? There is always an initial reaction of shock and disbelief. There is a sense that the loss is not real and cannot be accepted. There is a physical distress that may manifest as bodily symptoms of aches and pains, symbolizing the emotional pain felt at the sudden death due to COVID infection. The second stage of grief is yearning and searching. At this point, the child becomes acutely aware of the void left by the loss of his mother or father. The child searches for the comfort he was used to and remains preoccupied with looking for constant reminders or ways to become close to the parent again. The third stage is despair and disorganization. Eventually, the older child realizes that the loss is permanent and can become sad and hopeless, as well as angry and questioning why the parent had to die when so many others recover. Life feels it will never improve or make sense again without the presence of that parent who died, and the child may continue to withdraw from others until they hopefully reach the final stage of reorganization and recovery. This is when faith in life is restored, and the child will establish new goals and patterns of daily life. They will slowly start to rebuild and realize life can still be positive, even after the loss of a parent. Assuming, though, that there are other family members with whom they can establish close relations and possibly act as a substitute for mother or father. How can we help our children be resilient throughout this pandemic? Jones Hudson describes a 5-step psychological first aid for parents to apply in their homes. It consists of reflective listening, assessment, prioritization, intervention, and disposition. Reflective listening refers to when a child expresses his feelings or fears or mentions something they saw on the news. Then the parent can respond in a way that acknowledges that what they are going through is normal and do so in a non-judgmental and non-intrusive manner. We probably should not tell the child how they should feel or compare them to how others feel. It doesn't help if we belittle or criticize them. We simply reflect back to them what you sense are their underlying feelings. That is, giving a name to how they are feeling will help them gain insight. The gentleness, patience, and understanding we show will provide them some sense of relief and calm. For assessment, observe the child or teenager for any changes in attitude, mood, or behavior, such as changes in sleep pattern, appetite, interest with studies, socialization with the family or their peers, dealing with separation from the parent, or any signs of regression. One way of assessing a child is by finding the answers to the 4 basic questions. Is the child's reaction expected for his age? Are there previous or concurrent stressors in the child's life that affect his reaction? What are the child's coping skills? Can the family and community be counted on for psychosocial support for the child? After assessment, the next step is prioritization. The parent now has to prioritize which child needs medical, psychological, or psychiatric attention first. Is there a child who needs more reflective discussion, more private time, and more frequent intervention to help handle their stress? Or who shows more signs of distress? What need should I address first? The fourth part of the psychological first aid is intervention. And here are some suggestions. Create a safe space, a calming corner or chair where the child can sit for a while and calm down or sleep. Create a visual support board to help the child focus on the future and recovery from this pandemic. You can ask all of them if there are many children under your care, or together with your child, create a collage of images or pictures of places they would like to visit. List names of friends they want to reconnect with, or things they want to do once the pandemic is over. In this way, we can instill hope that all of these limitations and the spread of the virus will one day end. Keeping regular schedules or routines, eating healthy, getting enough sleep, being creative, cooking new dishes, learning new skills, finding new hobbies, getting to know each family member more, and enjoy storytelling, board games, watching movies on the Netflix together, and praying daily are other ways of dealing with the current situation while at home. Even young children can be taught a variety of stress management or relaxation techniques, such as taking deep breaths for 5 to 15 minutes and imagining beautiful nature scenes. Imagining cool air coming in to calm us down as we inhale, and hot air being released as we exhale. Coloring books can also be fun and therapeutic for any age. Grounding is helping the child become more aware of his environment. You can ask the child to close his eyes and then describe what you hear. What are all the sounds you can identify? What do you smell? Does it smell sweet? What do you feel on your skin, in your tummy, at the top of your head or the tip of your toes? What can you taste right now? Then ask the child to open his eyes and describe what he sees. For older children, more adult calming exercises such as meditation, yoga, shibashi, tai chi, or working out could induce her or him to feel more positive. Having nightly rituals before sleeping also helps the child feel secure. That is something he can expect and rely on regularly, such as reading a storybook together and praying for protection, thanking God for the day that has passed and hoping for a new day tomorrow. For the preteens and teens, perhaps just having a quiet heart-to-heart talk about his feelings, thoughts, plans, and ways to cope would be enough to make him feel secure because you care. Last on the list is disposition. The parent has to observe for changes with the interventions implemented for a month or so, and if the kids are adjusting to the current situation, then thank God. But if not, for example, there may still be signs of anxiety or depression, difficulties keeping up with online classes, or not interacting much with family, then consider seeking professional help. With the pediatrician if there are bodily aches and pains, with the psychiatrist if there are sleep or appetite changes, as well as disturbing attitude and mood changes, or with the psychologist. Ann Masters, a professor of child development at the University of Minnesota, noted that many faith traditions have incorporated ingredients for resilience, and which we can apply to our youth so as to address their difficulties and mitigate the trauma wrought by this COVID-19 pandemic. In her book, Ordinary Magic, Resilience in Development, she says, a connection to the divine helps us make sense of this difficult time. Cultural or religious traditions help in keeping calm and finding awe in our daily lives. And I think this all we feel could entice us to look forward to another day worth living. A relationship with someone or belief in something greater than oneself, whether spiritual practice, cultural beliefs, or a sense of purpose, can help families and children orient their thoughts, feelings, and actions. When kids are able to pitch in and contribute to their families, be it doing household chores or teaching grandpa how to send a Viber message, or perhaps help the environment and community by composting, recycling, and simply staying home to prevent the spread of the virus, and in effect, save lives, they gain mastery of themselves, feel valued, and their confidence grows. Children are neither inherently resilient or vulnerable, but their well being is a result of who they are as individuals and how they assimilate their experience. Kids generally bounce back if during this time they receive the emotional support they need from caring adults. So, with that, I thank you for listening and good day to all.